This area of the Medical Museum is a hodgepodge of so many different things, and it's all related to patients. First thing I want to show is this stereoscope made by Westinghouse X-ray company. And it has the catalog number here. It has the patent number. I believe this is around late 1920s or early 1930s. And as you can see here, they put film on each side, and they can control the distance. And whatever you want to X-ray, you have what looks like 3D image. So even in the late 20s and early 30s, they did the 3D images with a machine like this. In this museum, we like to also preserve some of the local history, whether it's Cabell County, Huntington, or West Virginia. And this operating table came from a hospital used to be on 6th Avenue with the name of Guthrie Hospital. In fact, in early 70s, when I came to Huntington, Guthrie's hospital was still open and had patients. So this is about 1940s, early 1950s operating table. It's all stainless steel, very similar to present-day tables. The other thing, on top of this table, you can see the doctor's bags, different kinds. One interesting thing about these, I kept the instruments of these doctors inside the bags. The next piece here is an examining table. This came from England, and it's wooden. As you can see, it's about 1850 type of table. Still has the original leather, and in here, on top of it, there is a doctor's medical bags. I call it the travel pharmacy, that it has all kinds of medications, and the doctor sometimes put medicine together on the spot. Very dry, very delicate at this point here. The other table here, again, this is all wooden examining table. This is about 1900. On top of this table, there's a very interesting piece here, extremely rare. I've never seen anything like this before or after I bought it. It's a midwife piece here that she will take it around to deliver babies. It's rubber, and it has, you pump air in it, that becomes like a donut here. So when the water breaks or blood from delivery, it stays inside here rather than spilling over the sheet and the bed. And then it's portable. It's folded after they clean it, and the midwife will go to another place for delivery. Another interesting piece here is the portable examining table. So this can be all folded, and you can carry it. Some family physicians used to do that. And it's basic, cloth here, heavy, but can be moved around. I have this crib because it's fascinating. The lower part of the crib is one piece of wood that's been carved, and this crib can be rocked on side to side to calm the baby. And it keeps rocking. You have to just push it every once in a while. The next thing here is a baby's basket made of wicker, and it's sitting up here. Certainly the baby should be very young because it's easy to jump out of it. Another rocker for children. It's all wood, 100%. Put the child here, and just similar to what we have in today's market. Another interesting one is this all wooden. Put the child here and push the child around. an interesting bedpan on a stand. Again, these are late 19th century, early 20th century, maybe earlier. But we put them there because it's related to patients' care and children's care. In the early days, they had no running water, and so this is the washstand here. You put the water here, and underneath is the pitcher to wash the hands or whatever you need to do. Another very interesting bedside pan. So the patient can just step here. The bedpan will be, no, it's not the bedpan. The commode will be here, and then it will be covered and it looks so innocent. I have two wheelchairs, and they are very interesting, these wheelchairs, because this I bought from England, and I call it the rich person wheelchair. As you can see, the wicker, you can see nice wood, brass on the wheels, special hand roll to roll the chair, and this is the average individual wheelchair. Again, it's like today's wheelchair. You know, you can fold this up so the patient can sit, and that's how the patient can roll himself or herself. But you can see the difference between the quality between this one and the quality of this one. And the only reason I put here this chair is because it's what you see in a pharmacy. And that's an advertisement for the Piedmont cigarettes. It's a folding chair. People ask, what is this car doing at the Medical Museum? And the reason is this car was produced by Ford Motor Company in 1926 as Doctor's Coupe. I think it was a little bit higher than an average coupe, and but they called it Doctor's Coupe, and I researched it, and it is in their catalog in 1926. This has been totally restored. This is the original car, totally restored in Milton, West Virginia. We have some great restorers in the state. And as you can see, this is the original engine. I mean, that's it. That's the whole thing about the engine. So simple. And to start it, you can start it with the starter, or you can crank it with this here. The restoration has been just wonderful, because if you can see inside here, everything was taken care of it very carefully. There was no air conditioning, so that's how you get air, is to open the glass and let air comes from here as much as you want. You can open it even more. And I think that's where the doctors used to leave their medications, examination, the bag, whatever they need in the trunk here, and it can be closed easily and locked.